of saying today, I can welcome you all coming from the unceded ancestral territory of the Musqueam, as well as recognizing that much of the lands in which we live, work, and play are the unceded ancestral territory of Musqueam, as well as Tsleil-Waututh and Squamish Nation. And so it's with great respect that I offer an acknowledgement of the stewards of the land in which we are on today, and their learnings and teachings that help us move forward and continue to be committed to the equity in the work that we do. I would invite any of you who would like to offer where you are and an acknowledgement for where you are situated today to please do so in the chat. As I said, welcome to the Capacity Seminar Series. Capacity, for those of you who don't know, is an interdisciplinary and multi-sectoral research unit here at UBC, and all these great people, so many of them here I get to work with. And today I'm going to introduce very briefly and let them introduce themselves. I'm going to introduce and say thank you to our gracious co-presenters, Cindy Elliott from Leadership within Providence Health Authority, and Sunny Zhao, who is a doctoral candidate here in the School of Nursing. And how we're going to do this is they're going to introduce themselves as they can speak more to who they are. I will just go wax on forever in who they are. And they're going to do a presentation, and then we'll go into some opportunity for discussion and questions and answers, and at which time I will moderate that, and Cindy or Sunny can jump in as well. And feel free if you want to put it in the chat or if you want to raise your hand. I'll do my best to keep us organized and moving along. And as I said, we will be recording, and so we'll have the opportunity to circulate that link for folks who aren't able to be here or want to hear more about kind of this work. So again, incredibly grateful to Sunny and Cindy, and I will hand it over to you to lead us off here. And yes, welcome. And again, thank you so much for being willing to engage with our team and explore these kinds of issues that, as we're all students and leaders, that we grapple with, and how to collaborate and create meaningful and useful research for our healthcare system. So over to you, folks. Thank you.
Thanks, Vicki. And thank you everyone for joining. Sunny, thanks for advancing the slides. So I'm Cindy Elliott, and I'll do an overview of our presentation here and do my introduction. I'll just take a moment to acknowledge that I am also on the traditional unceded territory of the Musqueam, Squamish, and Tsleil-Waututh. I have the honor of being born on these lands, and I have lived, worked, and played here in this area my entire life. I'm super happy to have the opportunity to work in our healthcare system and provide contribution to the healthcare system, which hopefully benefits many of the people that live in this area. So also extremely grateful and proud to be here today with Sunny to share some of our learnings and our experience together. So what Sunny and I are going to do here, we'll do some introductions, and then I'll give a bit of an overview about the space where Sunny did her work, and that is the St. Paul's Emergency Department. Sunny will give an overview of her work, and then I'll come back into the conversation to give some perspectives from a leadership point of view, engaging with a grad student doing some research. We are looking forward to and hoping to have some good discussion and questions with you all. So looking forward to that. We do have, I think we've got a really great bit of information here that we're going to share with you. So I'll just start by telling you a little bit about myself. So I'm Cindy Elliott. I'm the Program Director for Emergency Services at Providence Healthcare. So that includes St. Paul's Hospital and Mount St. Joseph Hospital. I'm also the site leader at Mount St. Joseph Hospital, and I'm the Regional Director for Emergency Services for Vancouver Coastal Health. I've been a registered nurse for over 20 years, and I've spent my career at Providence Healthcare. I am an emerge nurse, and I came back into the emergency team about 3 years ago, and I love being back in the emerge, and I want to do anything I can to improve the care experience for our patients' families and also the people working in the space. So, Sunny, do you want to introduce yourself before I say a little bit more about St. Paul's, or do you want to wait until we get to your slides? You can go ahead and introduce yourself maybe now before I continue.
Myself, for sure. Hi, everybody. My name is Sunny. I am currently a PhD student here at the School of Nursing. My background in nursing is actually in psychiatry. So I worked a couple of years in inpatient psych, and I moved down to the Emerge and worked as a psychiatric liaison nurse for a couple of years. And then I went back to school, and now I'm doing my PhD and doing this wonderful work around harm reduction that I'm looking forward to sharing with all of you today.
Great, thanks, Sunny. All right, so I'll just see if I can. St. Paul's Emergency is a fairly well-known emergency. I'm going to make an assumption that you're all aware of St. Paul's Emerge, but I'll just tell you a little bit about it. So we're situated right downtown, and we're a 24/7 operation. We see about north of 250 people a day, and volume across all emergencies are up right now. So we're on track to see about 92,000 people for this year. That is, we've got 60 care spaces, which include some acute care stretchers, 2 trauma bays, our fast track area, and we've got up to 60 spaces now because we've squeezed in a few other chairs to create some additional space. In our emergency, we've got our ABSU area, which is dedicated to psychiatry care as well, but is operated by the emergency team. So that is part of our space that we operate. About a $20 million a year budget. We've got about 350 people on the team in the emergency department, and that includes, of course, emergency physicians, emerge nurses, registered nurses, psychiatric nurses. We've added patient care aides. We've got our registration clerk, social worker. We've added a physiotherapist full-time to the emergency recently, and then of course all of our support services with housekeeping, and then we also interact. So about 350 people on our team, and then we work with all the other teams. So we're a very open public space, of course, because of the consult services. So we've got people that come and work in our space with us and our patients. So our team is, we've got our team, and then our team is actually the broad system because of all of the programs that we work with. St. Paul's is a long-standing partner with UBC and an academic center. The St. Paul's Emergency itself has contributed significantly to research in the medicine realm. Our emergency physicians are a very academic group, and we've done lots of research in the department. There's, our team is used to doing research and supporting research in our space, and promoting research outside of just medicine research is something that's been a priority for us. So this has been a great opportunity working here with Sunny. Overall, in the emergency, we're always working to improve our workflows and our care, looking for innovation in a variety of different presentations with technology advancements. I just thought I'd share right now that I think like our number one focus in the emergency right now, and it's not uncommon across emergencies, is safety in the space. And that includes, to my mind, a lot of things when we think about safety, but violence and aggression is a very real issue right now, particularly at St. Paul's Hospital Emergency. We are faced with some very escalated behavior, and we've got a large piece of work right now around improving safety in the department that is our focus, and it includes a variety of aspects, including the care experience and how we interact with the people we care for. In addition to that, of course, we're building a whole new hospital, so we've got a big focus on planning for the new St. Paul's, which will open in 2027. So that is the space where we do our work, and where Sunny came to do her project. So I will maybe, if you want to go to the next slide, Sunny, and I'll turn it over to Sunny to tell us about the work that she did in the St. Paul's Emergency.
Thank you so much, Cindy. I'm so honored to be here today with Cindy to do this seminar together and to tell our story of how we work together. And I hope through our seminar today, we can really illustrate what we mean by partnership and what it looks like, and how as students, we can do our part to ensure that our work is useful and relevant for the agency or the organization that we're partnering with. I'm going to first share a little bit about my PhD work, kind of the research that I'm doing, the purpose and the methods, and then I'll kind of move on to tell kind of my side of the story, the student perspective. So the purpose of my work is around examining if and how harm reduction interventions are being implemented in BC emergency departments, and also the contextual factors that may impact that implementation. So by contextual factors, I mean a lot of different things. It could be like staff attitudes or staff knowledge, availability of kind of wraparound services or resources, organizational policies, all of those different things. And I have two specific research questions, which are how are BC emergency departments implementing harm reduction, and what are contextual factors that may influence implementation in that setting. And my study is mixed methods and uses a case-based methodology. And I have 3 different data sources, and they are a staff survey with emergency department physicians and nurses, and qualitative interviews with physicians, nurses, and clinical leaders, and policy documents at the organization level, either about harm reduction or about the use of unregulated substances as a whole. So in doing research, as you know, we always talk about this idea of kind of gaining permission for entry. So for my work, St. Paul's Emerge was one of the 3 sites that participated in the EQUIP emergency study, which is based out of the Cry-High research unit here at the School of Nursing. And that project is focused on promoting equitable care in the emergency environment. And Dr. Bungie, my supervisor, is a co-PI of that project and the site lead for St. Paul's. And I served as the interim site coordinator for that project for about 2 years, where I was responsible for supporting and facilitating a research working group. And I thought of myself as a mini messenger person between the working group and the larger research team. So drawing on those already established relationships, as Dr. Bungie formally introduced me to the leadership at St. Paul's, including Cindy, and also Iggy Black, who is the director of the health services and clinical research and KT at Providence. And we set up a meeting with the 2 of them to share more about my project and kind of request permission for us to engage with their site for my work. And previous to that first meeting, I sent the leaders kind of a 1-page summary of my project. I actually had a few questions from leadership, even before that initial meeting. And one question was around, what time frame are we looking at? Because they were mindful of recruitment and interview timing, given that they recently launched an electronic charting system that was new for this for the organization, and we're also strategizing around COVID at the time. So we responded with kind of an estimate of when we would be ready to restart recruitment and how long we anticipate data collection was going to take. But we really tried to emphasize that we will accommodate the needs of the site, their operational needs. And also we recognize that the timing ultimately needs to work for the organization, and the patient care comes first. So we met with Cindy and Eggy. So I introduced myself and my project and talked about kind of why the research is needed and why I want to do this work, and my 3 data sources, and what I think St. Paul's is the right site and a good fit for this work. And I think I'm incredibly lucky. The leaders showed immense interest in the topic, which is really relevant for them. And they were very committed to see the project go forward. And in that meeting, we discussed kind of what I needed from them, and more importantly, what was in it for them. So in terms of what I needed, we were hoping that the leaders would be champions for the project, and they can help with spreading the word and recruitment and that kind of thing. And because, I have both nurses and physicians in my proposed sample, I would love to hear their suggestions as to what are really effective strategies to elicit engagement from the 2 different occupational groups. And I would also need help with sending out kind of mass recruitment emails and permission to post my recruitment posters in the staff lounge. In terms of what was in it for the organization, We would, of course, be sharing the findings from the research, including any recommendations, and we would be consulting Cindy and Aggie about how to do share back in a way that would be most useful and relevant for their organization, their context. For their recruitment strategies, we talked about how to engage physicians as a group, right? So we talked about the potential of having a physician-specific champion for the project who could then kind of forward the invite to their colleagues and say, hey guys, this is really important work. Let's make sure our voices are being heard. And the leaders also brought up like some queries for us. At the meeting, they raised the importance of targeting interviews in a kind of a bigger way, and not to only capture registered nurses, but also psych nurses who work in the Emerge, and also nurses who work in the Rapid Access Addictions Clinic at St. Paul's. So I previously planned on only doing interviews with nurses and physicians, but the leaders noted this need to capture greater diversity and the larger context, and suggest that maybe we could expand the scope of the interviews to also include several nurse leaders. So after that meeting, we responded to those queries, and I think I said, thank you for the queries. They really help to make this work really relevant and meaningful, and we would indeed be expanding our sample for the interview to include nurse leaders, and we will also be extra attentive to trying to recruit a greater diversity of nursing staff in the sample. And Aggie very kindly connected me to the person who's responsible for updating all the professional policies at Providence. So they would have the most up-to-date knowledge in terms of what's available and how I could collect them and how I could access them, that kind of thing. So when it was the right time for the organization, Cindy said, hey, I'm ready to support you to launch. So we met and we walked through a data collection plan together, and we had a few strategies. And one was a kind of giant email blast from Cindy to the team. And also we would be posting some recruitment posters with kind of the QR scan codes in the staff lounge as well. And I think at that time, Cindy also connected me to two physicians who are incredibly passionate about this work, around harm reduction, also improving care and improving quality of care for people who use unregulated substances. I met with them, and also one resident physician who was working with them who's also interested in the topic. Again, I introduced my topic, why I wanted to do this work. I acknowledge that St. Paul's is very much a pioneer in the country in terms of interventions to improve care for this patient population. And before I went to the meeting, I looked up interventions that already exist in the department so I could list some examples. I know that the specific physicians have contributed a lot to the creation and existence of some of those interventions. So, I relate that I'm really excited to be able to work alongside people who have done so much already and are so committed. And at that meeting, we talked about the recruitment plan that Cindy and I created, and I asked them to be physician champions for my project. They were totally on board. They actually said the research dovetails nicely with some harm reduction related QI initiatives they had going on in the department. And they asked if I would be able to provide them with an interim summary of sorts of some of the survey findings before the final dissemination of my results. They actually referred to their involvement in the project as kind of a win-win for everybody. And they said that they were going to redirect Cindy's mass email to their physician group and then add some physician-specific targeted messaging. And both of them were also going to do some word of mouth recruitment for us, which was really wonderful. So after that meeting, I was in touch with Cindy just to let her know that the meeting with the docs went really well. And this is our plan, and just to thank her again for making that connection for me. Cindy also connected me with the group of clinical nurse leaders, got me invited to their meeting, introduced me to the group just so that they could meet me, hear about my project, and they could ask questions. I introduced my topic, talked about, when the launch would be. It would be really wonderful if you would support the project, and I would also appreciate any suggestions for recruitment. they had. And they came up with this great idea of inserting our recruitment poster with the QR code in the sign-in book where people sign their name to get paid so they can have a look at my poster. And Cindy also connected me with clinical nurse leaders and the clinical nurse educators for the various kind of wraparound programs. So I set up meetings with each of them to share more about the project, to answer their questions, and to ask for their support. As I mentioned, like one of our goals was to capture greater diversity in nursing staff. So that includes nurses that work in the psych section, also in the RAC. So I met with the leaders for those two respective subsections, and we came up with some targeted recruitment emails for nurses that work in those settings. And it was around Easter time, Cindy sent out that mass email for recruitment, and our physician champions redirected the message to their group. And I remember they emailed me to let me know they sent the message, and they said, we wrote, it took me 6 minutes to fill it out as their part of their messaging to their colleagues, which can be really helpful. And they also said, let us know how the response is. And if it's not good, then we can nudge. And the response to the survey was immense, I would say. We had 40 surveys just in that first week. And I had a question at the end of my survey that was kind of like, are you interested in an interview as well? And by the end of the first week, we had 14 people sign up for the interviews. I mean, not everybody ended up doing an interview, but it was still a good sign of positive things to come. And then every week forward, I think it was on a Tuesday, I always sent out an email update to everybody about our numbers and kind of next steps for recruitment. And I think the leaders and the physicians were appreciative of the update, and we were also able to optimize our recruitment strategies in real time. And then now is the embarrassing part of my story. So I did my survey on Qualtrics, the UBC kind of approved survey platform, and there was a bit of a technical problem that resulted in me miscounting and reporting the wrong number to everybody. And I told them that we reached our target sample, and of course everybody was ecstatic, but I had to tell them that I made a mistake, and there was still kind of a ways to go. When I realized it, I just felt really embarrassed, utterly embarrassed. I thought it was all over, and I didn't know how to tell them. But gathered myself up and just wrote an honest message. This is what happened, and just apologizing. And they were completely understanding. And the error, I would say, didn't change anything at all in our working relationship. All that to say, mistakes happen, and it's okay. Just as long as we face these things with honesty and integrity, it's not the end of the world. So eventually we were able to reach our target number of 100 surveyed with staff. The sample is actually split quite evenly between the nurses and physicians, which was amazing. We also were able to reach our target sample size of 10 interviews with staff, and we also had 5 more with nursing leaders for the interviews. We ended up not doing any staff-specific interview recruitment because we got our full sample just from the question at the end of that survey. So needless to say, we would have never been able to reach our target sample without the full support of Cindy, of Eggy, the physicians, the clinical nurse leaders, the educators. And I think you can see just how much work that the organization put in to help with recruitment. I mentioned before that one of the asks of the physicians was kind of an interim report of some of the survey findings. At the time, I just thought, okay, they helped me so much, I need to give back. And I thought, okay, it shouldn't take me too long to make that available. But that's where I was very naive, and I didn't realize like all the work that needed to be done prior to being able to share your data. And I also didn't fully consider kind of the implications of data sharing for the rigor of my work. So my supervisor, Dr. Bungie, very patiently stepped in and explained to me about the processes that were involved before I could formally share my data, and also when it came to sharing, how to do so in a way that also protects the rigor of my work. So now that some time has passed and we are ready to share some of the preliminary data, Dr. Bungie and I met with Cindy and Eggy, and we did a bit of a share back presentation with them. We talked about the participant demographics for the staff survey, some of the data we had on staff attitudes, and also harm reduction related workplace education. We also put some of this data in a formal citable infographic to share with the physicians, and with a note that the data presented are preliminary and they have not been kind of integrated with the rest of the other data sources and are unable to lead to kind of formal recommendations on their own. Also, Cindy, as she mentioned, she's really interested in the topic of violence and interested in the data that I have around violence. So although violence is not my primary research focus, staff spoke a lot about violence in the interviews. And so Dr. Bungie and I are actually in preliminary talks about the potential of writing something on the intersection of violence and harm reduction implementation, which I think would be wonderful and would certainly be of the interest to Cindy as well. All that to say, we're way past the point of recruitment and data collection now, but it's so important to continue to engage in ways that really show reciprocity. That's all I have prepared for my side of the story. And I'm really grateful to have had and continue to have such a positive experience. And I attribute this positive outcome to a number of things. Like first would be how relevant your research topic is for the people that you're partnering with. And second, it's efforts from both sides to really try to build and nurture that working relationship. And lastly, just continue to work together through showing respect, authenticity, and reciprocity. Thank you. I'm going to pass the mic on to Cindy now.
Thanks, Sunny. So I thought Sunny's done a brilliant overview of how this work played out and the ways in which we interacted and how we were able to support for the recruitment for this study. I thought it would be important for me to kind of share a little bit more around what made me so motivated to participate in this work. And I think that the relevance of the topic, of course, is a huge part of that. So harm reduction is a huge piece of work at Providence Healthcare and St. Paul's Emergency. Certainly, I think, Sunny, you said pioneering. We've been working. We are I'm not going to say we're the chosen hospital because we're not, but we are downtown. So we are kind of close to the downtown east side, and we have had plenty of opportunity to work over the years with people who likely need some harm reduction in their lives. So many people that we care for, that might not be what they're presenting for. Often it's not what they're presenting for, but it's a very complicated time for them because staying well includes a variety of things when you're somebody who uses substances. So finding our way is complex and very it could potentially the damage we could do to the care experience and ultimately the person's well-being from what they're presenting with as their chief complaint, but also their overall experience with interacting in the healthcare system. So when Sunny approached, when we had our introduction and I learned what Sunny was setting out to do, it made nothing but wonderful sense to me to understand exactly what Sunny was seeking to find out, because we have resources, we've got guidelines, we do have some good structure in the way that our staffing model is set up inside and outside the emergency department. But understanding how does all of that come to life when people are interacting with our patients is something that is very important to me as a leader, because you can have a guideline, but if it doesn't come to life, or you can have resources, but if they're not utilized, then there's what's the point of all of that? So the partnership with an administrator like myself or a leader like myself is the relevance in the clinical space. So it makes good sense that somebody would not set out to go into a clinical space where it's not relevant. But I think when you're designing your research question, or you've already designed it and you're understanding the clinical space learning a little bit more about it so that you're a little bit prepared coming into it to almost, I mean, it wasn't, Sunny didn't have to sell it to me. It sold itself because of what I've just explained to you. But I think that idea of helping people see what the relevance is in their clinical space and addressing a real life problem is a big bonus. So the other thing that was kind of in it for me was my opportunity to contribute to the planning. So, you know, there's a difference between giving the go-ahead, a green light to something to happen in the space that you're leading versus contributing in a meaningful way for ultimate success for the project, because success for the project is going to mean success for our patients and families. So the contextual knowledge that I have, I was able to work through with Sunny what her plan was and add in a variety of things like the timing of when to do this for best opportunity, and then making sure that there wasn't going to be unexpected barriers. Maybe like if I had just said, yes, sure, Sunny, go ahead and do whatever you need to do and let us know. I mean, we really worked together to design the timing and the communication and when and how. Motivation for myself is also around my personal professional accountability as a registered nurse and what me as a nurse is setting out to do in my space. So as an administrator, I've got a wide variety of responsibilities, and some of them don't necessarily nurture my soul so much, but the opportunity to contribute to the advancement of nursing knowledge and evidence and supporting nursing research was something that was beneficial for our patient population, but it also was very beneficial for me. So I had a lot of personal satisfaction. Not everybody has different drivers for personal satisfaction, but that certainly was something that was of benefit for myself. A big piece that I thought was very important, I was so keen on this topic because the impact of interactions at the point of care are so profound. If I want to implement changes in practice, what better than to say, well, here's the evidence that was born here in our space from you. This is what you told the researcher. So the evidence that we will gain from this work it's a pretty easy sell for me, because it's not like I'm trying to take something else and retrofit it in and educate people. So the knowledge translation process will be something very different. There's a different level of ownership and acceptance and pride in the work. So I'm looking forward to the next steps and how we're going to do that, Sunny. And I know that the team is going to be more willing and motivated to make those changes and integrate the evidence into our space, because it comes from our space. I spoke earlier about the long history that St. Paul's Emergency has as a research space. And you can feel it when you're in there. People are proud of the evidence that we create, and it nurtures our desire to continue to contribute to research. So, when interacting with when looking at different projects that people are looking to do, it's like, what could the program gain? I've talked about the impact on patient care, which is to me the most important. We also have the opportunity, because St. Paul's is a place that across the region, the province, and the nation, people have turned to us around this topic and other topics. But harm reduction is certainly one. We are asked to provide feedback, input, advice, whatever it might be. So for work like this to be added to our knowledge is amazing. So as a program and as an organization, we can say, yes, we participated and supported this research to happen in our space, and here's what we learned together with the researcher. So we can impact people kind of immediately at the point of care, and we can promote the organization, and then we can I'm well positioned, and my program's well positioned to spread this knowledge, so we can have kind of micro and macro impact. Now, I happen to be somebody who was personally motivated, my passion around promoting nursing knowledge. I have a real life problem in the area that I'm responsible for. And so it was an easy sell for me in some ways. So what do you do when you have a clinical space that you want to go into and you want to gain the support of a leader and partnership with a leader that maybe doesn't have the level of passion that I had for this project? And I think the key to that is, like I said before, it's not like I don't think people are going to be going out to be doing research in a space that makes no sense about the topic. That said, being, I think, taking some time to understand the context of the clinical space that you're going into. So, Sunny had the benefit of being part of the EQUIP group, so she knew it well, and that's wonderful. And there are other ways to do that. So, planning a way to get a little bit more information about the space, currently what's going on in the space, and getting those introductions. So, I think on one of Sunny's slides, she talked about nurturing relationships and really maximizing on those introductions. So, the healthcare community is massive and also very small at the same time. And I have learned, it's taken me a little while, but I've learned you'll meet people along the way and you'll meet them again and again. And when you get the opportunity, when somebody says, you know what, I think you need to meet this person, don't take that lightly. That's a good indicator that that you probably do need to meet that person. And then when you do, create space for sharing what you're doing and why, and then also make sure you create that space to understand more about them and invite and open some feedback from them about the work that you're doing, because Sunny provided me all the space in the world to contribute to some of the design stuff. We talked about expanding who you were going to canvas for interviews, and then also with so much patience and grace, listen and accepted the reality of what was going on for us operationally in this space, because the timing had to be right to do this, and I didn't want the work to get lost in all of the other things we were doing when we went live with our electronic health record. So that would require, some good, sometimes things happen and there's more firm timelines that need to be met. But I think if you don't have an immediate common passion that's very evident, then it's making space to find that common ground where what is the leader going to get out of this ultimately, aside from, having the work done in the space and opportunity for their team to participate. So working together to understand each other's motivations and needs you'll find that common passion. So I think that's it's the nurturing the relationship a little bit if that doesn't seem evident immediately, because if you're going to a clinical space that makes sense for the research that you're trying to do, the passion, the common passion and motivations are there. It's just trying to give yourself space to build that relationship so you can find it together. So I think that's, I think we really want to have some conversation with you all. I'm hoping that you might have some questions or comments. We're happy to talk more about anything we've shared here today or other questions you might have. So maybe we'll pause there.